Well, the recent COVID surge is alarming. We've seen the positivity rate spike and hospitalizations dramatically increase.
We're learning new information about COVID daily, so we want to bring in an expert this afternoon to join our conversation and answer some questions you might have. Dr. Rick Martinello, Medical Director of the Infection Prevention Department at Yale New Haven Health. Doctor, thanks for being with us.
Good afternoon.
So was the surge expected, or are you surprised by it taking you off guard, this new variant?
Well, we're disappointed, certainly, but not unexpected.
Yeah, you know, it's important to note that there's a lot of talk around the Omicron variant, but it's really the Delta variant that's causing the infections we're seeing right now. What's your advice to people out there who are seeing the surge? I mean, our positivity rate went back down today, but you really got to look at the 7-day rolling average, and hospitalizations are the number that's pretty alarming. We're up past 500 now.
Yeah, I think the best advice at this time is that if you are unvaccinated, to get vaccinated. And then, of course, if you're vaccinated but have yet to get your booster, now's the best time to go out and get your booster. Beyond that, it's what we've already heard. If you are in public, if you're around other people, be sure to wear a mask.
I want to talk to you about these vaccines and boosters that we're seeing. You know, we see people getting their vaccinations and their boosters, and then they're protected for a certain amount of time. But unlike a measles or a chickenpox vaccination, this is wearing off after a certain amount of time. Do you think over time, what you guys are seeing at Yale, are we going to see these vaccines and injections strengthen so they have a life longer than 5 or 6 months?
Well, I think it will take time to sort that question out. We'll just need to have a little bit more time to really understand not only what is going to happen with the virus and the pandemic, but also to see what that durability of our immunity is. I think it's important to remember that many of our vaccines, including flu vaccines for our youngest patients, require multiple doses to have the appropriate amount of protection. So not surprising that we see that we need multiple doses of COVID vaccination to protect ourselves.
We learn new information on Omicron daily. Any updates on its transmissibility or its severity? I know we had some good news from the Pfizer booster, which showed that it could be neutralizing the Omicron variant. But as we anticipate that variant spreading more here in Connecticut, what do we know about it?
Well, some of the estimates now are this variant may be as much as twice as transmissible as what we were seeing with earlier strains of COVID. And then also, as you mentioned, some of the bad news is that our vaccines may not be as effective against Omicron. However, the good news being that getting a booster, there's some data that was released by Pfizer today showing that a booster provides a 25-fold increase in the amount of antibodies that are effective against Omicron. So really further evidence suggesting that getting a booster is going to be really helpful.
Dr. Rick Martinello from Yale New Haven Health. Doctor, thanks for being with us. We appreciate it.
Thank you.
Thank you.